Does your textbook covers each and every tiny detail of the drug? I mean everything, physical, chemical, features, characteristics, all the trade names, all the information about the drug standards, purity, how they are preserved, how the drugs are stored. Does your textbook cover everything? Well, if the answer of this question is no, then I will tell you what are the actual sources of drug information and a lot more about the drug information sources in today's episode. Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MPBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. The minute details about the drugs, about the trade names, about the drug standards, the physical, chemical properties of drug, about the drug purity, how the drug can be preserved, how the drug can be stored. All these details make a lot of importance, especially when it comes to legal point of view. The very detailed literature of the drug is referred to as a collective term, and this term is known as drug compendia. Now, how will you imagine this drug compendia? Let me picturize it. Just imagine it nicely. It's in the form of a monograph. Okay, I hope you got a little picture of that. The main two included in the drug compendia are the pharmacopoeias and the formularies. So, drug compendia is a collective term and it consists of pharmacopoeias and formularies. Actually, since the government control is exercised over these, they are called as official compendia. Official, anything to do with the government control is official. Now let's get to know minute details covered in each of them. Are they complete or they ought to have some flaws, some missed information? All things we're gonna find out just now. Let's start the talk with pharmacopoeia. Now, pharmacopoeia in a country, the physicians, they form the main body for its supervision. It covers a lot many drug details and aspects like chemical structure, chemical characters, molecular weight of drug, the physical features, the various drug assay techniques, the solubility of the drug, how the drug is identified, etc. It also covers many broad related aspects like purity standards, how the drugs can be stored in proper way, how the formulations of the drug in the form of dosage form it can be made for the approved drugs in a particular country or region. All this and related much more is actually depicted in the literature body of pharmacopoeia. Is all this useful for doctors? Is it? What do you say? I don't think so. It makes more of a sense to the drug regulators and drug manufacturers. Well, trade names are actually avoided in the descriptions of pharmacopoeia. Take it as a note point. Now, let me tell you what are the most well-known ones that we need to know. First of all is capital I and capital P. They stand for Indian Pharmacopoeia. Then we have capital B and capital P. They stand for British Pharmacopoeia. Then we have capital U, capital S and capital P. That stands for United States Pharmacopoeia. So, with these names of well-known pharmacopoeias, let's next have a word about formularies. So take a break, sip some coffee, These are weekends, and weekends are known to be privileged, so just relax and let us go. Now, formularies, for these, the pharmacists, they comprise of the supervising body, not the physicians. Okay? Now, these are actually the booklets, and they can be carried, and they are very convenient to use. They have all in all the indications for the drug use in a listed format. They also have descriptions proper of the drug dose, dosage forms, various cautions, contraindications, side effects, the different ways to store the drug, etc. And apart from the drugs, it may also contain a few of the fixed dose combinations also, which are really important and ought to be included in this particular booklet. Now, before you'll find the drug description, you will get to read some of the text about the respective drug class and also about the different clinical setups, conditions of that particular drug use. You will also find treatment guidelines, account in this particular formulary. There may be some of the added or deleted details in the formulary varying from region to region. So it's not a confirmed thing that you'll find everything, but most of the things you'll find. Now, the Pharmaceutical Codex, or we can call it a British National Formulary, abbreviated as capital BNF. It is published by the Pharmaceutical Society of Great Britain. It includes information like brand names of the drugs, and also it includes the drug cost. And on the other hand, the National Formulary of India, which is abbreviated as capital NFI, it does not include any of such of the details. So that is why I told you there may be some added information, there may be some missed information, some not of much importance. It all varies from region to region. Then United States, it has a national formulary too, given by the American Pharmaceutical Association. Then you may find some good descriptive appendices attached to these formularies. All in all, I would say a complete booklet or guide. Whatever you want to see, whatever you want to refer to, it is for the doctors, and a really good one for you also, and a really nice reference booklet or material, you can say. It contains almost all the desired drug information for a quick reference, I would say. So this was a brief chit chat about the official compendia and of most of the well-known lands. So next topics comes to be non-official compendia, but it will be discussed in the next episode, and to be very honest and true, next week. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, Is Pharmacology Difficult. If you're listening for the first time, do follow me here, whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcasts. Stay safe, stay happy, stay enlightened. Thank you.